look at the drugs acting. Alright, so now let's look at the drugs acting on the endocrine system. So on the intro part, I would say, hello my dear learners, I'm gonna welcome you to this unit of pharmacology where you learn about the drugs acting on the endocrine system. Pay particular attention as we explore this unit to equip you the much needed knowledge for the betterment of your clients and patients who will undertake your care. So the objectives that we'll have in this unit is that by the end of this unit, you should be able to describe the following drugs that acts on the endocrine system. The first one is the corticosteroids. So the corticosteroids, that's the first part that we are gonna look at. Then the second one, we'll look at the androgens as well as the anabolic steroids. The third one, we'll look at the estrogen as well as the progesterone. Fourth one, we'll look at the anti-diabetics drugs as well as the glucagon. Then the fifth one, we'll look at the thyroid hormone as well as antagonists. Okay. Then the sixth one, we'll look at the pituitary hormones as well as the parathyroid-like drugs. Okay. So now, before going through the drugs acting on the endocrine system, it is important to just establish a fresh memory of the meaning of the endocrine system. Maybe perhaps we just go back and they just give you a memory on just the endocrine system, about the endocrine system. So the word endocrine was just driven from the Greek word that is called endo. Endo means within. Endo means within. And Clinis means secretes. So clinis simply means to secrete. Okay. So endocrine system, it is just a collection of glands. And these glands are 8 in numbers. And each of these secretes different types of hormone that regulates metabolism, growth and development, tissue function as well as the sexual function, reproduction, sleep and moods, among other things. Okay, so now I'm gonna showcase you this image of the endocrine system. So this image here, it has the endocrine glands. Remember, we have the pineal gland. Remember, the pineal gland, it is the gland that secretes an hormone called melatonin hormone. And melatonin hormone, it is the hormone that is considered to be the biological sleeping hormone. It is the hormone that makes a person to feel sleepy. So this is the biological clock. It is the hormone that makes a person to sleep. It is produced by the pineal gland, and it is found, like as in the midbrain, that is just on the peripherous part of the brain. Then besides that, we also have another one. We have the hypothalamus. The hypothalamus produces 2 hormones. Like it produces the vasopressin hormone that is commonly known as in the antidiuretic hormone, and also oxytocin hormone. Then we have the pituitary gland. The pituitary gland is also considered to be the master gland because it is the one that controls all the hormonal secretion in the body. Then besides that, we also have the thyroid gland. Now, the thyroid gland is just found just at the neck here, posteriorly. So that is on the anterior part. So anteriorly on the anterior part of the neck, that is where you get to find the thyroid gland. Okay. So now this thyroid gland produces an hormone called thyroxine hormone, the hormone that is responsible for growth and development and also brings about metabolism. Okay. Now besides that, we also have the thymus. Then we have the pancreas. Now the pancreas has what we call the islet of Langerhans. So this islet of Langerhans, it has 2 specialized cells. It has the alpha cells as well as the B cells. So the alpha cells and the B cells, these are the cells that triggers the production of the 2 hormones that are found within the pancreas called the insulin and the glucagon hormone. Okay, so these are the hormones that are tailored by the pancreas. Then we have the adrenal gland. The adrenal gland is found on the superior surface. It is just on the superior part of the kidneys. Okay, so if you check these kidneys anatomically, the way these two structures relate, you realize that the right kidney, it is quite bigger than the left kidney. So okay, the left kidney, it's quite small. The right kidney is quite bigger than the left kidney. Yes, okay, so this is how it goes. So the right one, it is smaller, because on the right side, this is where now the liver takes up its position. So the liver goes down even to the lower part of the lower part of the kidney, of the right kidney there. And then on the superior part of the right kidney, they are found a gland called adrenal gland. And this adrenal gland, it produces an hormone that we call adrenaline hormone. And this hormone is the one that usually prepares the body for action. It stops peristalsis. It also stops digestion. It prepares the body for action, and then it also makes a person to act. So those are the preparative procedures that this hormone is tailored to. Then besides that, we have the testes. So the testes, these are the sexual. These are the sexual reproductive organ parts that are found in a male candidate, or in a male person. So in a male individual. So now here what happened is that these testes, they produce an hormone called testosterone. Now remember, testosterone is an hormone that is produced in males. Okay. Then besides that, we also have the ovaries. So the ovaries, that is in the females. So in the females, they produce estrogen as well as progesterone. So those are the hormones that are produced by these two hormones. Okay. So this is what you really. This was just a quick recap of endocrine system, so that you don't forget about the endocrine system, the anatomy part of it, as well as the anatomical structure, and also the physiology component that this endocrine part does. So that is how it goes. Now let's proceed with it. Okay, let's proceed with it. Let's look at the endocrine. So endocrinology. Endocrinology refers to the study of the coordination. Okay, endocrinology is just the study of the coordination of the body function by chemical messengers. Now, when we say chemical messengers, what do we refer to? Chemical messengers, we are referring to hormones. Remember, hormones, these are chemical messengers that are produced by the ductus glands, transported by blood to the targeted organs. So these are hormones. Okay, so the multiple activities of the cells as well as the tissues and organ of the body are coordinated by the interplay of several types of chemical messengers, that is under the neurotransmitters, such as, okay, so on the neurotransmitters, on these chemical messengers, we have the neuroendocrine, we have the paracrines, we have the autocrines, and we have the cytokines. So these are the chemical messengers that you should put on your fingertips. The neuroendocrine, the paracrine, as well as the autocrine and the cytokines. So these are just four chemical messengers. So now let's start now with the corticosteroid. Okay, on the drug part. Okay, so now the corticosteroids. Okay, the corticosteroid here. So this is how these drugs works, and this is how they go. Like as in these, they are just naturally secreted by the adrenal cortex. Okay. So now you should be able to understand that corticosteroids, they are secreted by the adrenal cortex. Okay. So now the cortisol and the cortisone. So we have the cortisol as well as the cortisone. So now let's look at the synthetic, how these the synthesis, the production of corticosteroids. So production of corticosteroid, it involves the cortisol as well as the cortisone. Okay, it involves these two components, these two messengers, the neurotransmitters. Okay, so now it involves the cortisol as well as the cortisone. So on the synthetic part of corticosteroids, we have the glucocorticoids. Okay, so now these ones, they come in 4 different groups. We have the betamethasone, the desamethasone, the hydrocortisone, and the prednisone. So these are the 4 parts of these drugs that we have. So the hydrocortisone as well as dexamethasone and the betamethasone. So now let's look at the pharmacological action part of these drugs. So do you remember the influence of corticosteroids on growth and development? Do you remember this part? Remember on the part of pharmacology that you did in first year, first semester, second semester? I think in pharmacology there was this component, but if at all you've forgotten, I'll remind you, and I'm gonna walk you through and on the influence of corticosteroids on growth and development. Okay, so well, let's just have a look at the foreign action of these corticosteroids. Okay, so now metabolic effects. Let's look at the metabolic effects of corticosteroids. So they increase the blood glucose levels. So corticosteroids, number 1, they increase the blood glucose levels. 2, they increase the lipolysis. Okay, so now when we say lipolysis, this is just the busting up of these lipid component content that are found in the lipoproteins and also these the lipoprotein part of it. So these fats are broken down. The lysis there, it is just a breaking part. Where are you trying to say that these are broken down? So that is the metabolic effects. Okay, then besides that, we also have the fatty redistribution. So now these fats will now be redistributed. Now when we say lipolysis here, we simply means that when these fats are too many, like as in they're going to be broken down by corticosteroids. So corticosteroid has the power to break these lipids, which are in the form of a polymer. They can break them down from a polymer to a monomer. Now, a polymer is a large molecule and a monomer is a smaller molecule. So now, when we say lipolysis, this is now the breaking down of the polymer lipids into a monomer lipids. Okay. Now, besides that, then it will also now trigger into what we call the fatty redistribution. And then the third component that you need to remember also is that they also help to promote the catabolic effects, except in the liver. So they help to promote catabolism, except just in the liver. Okay. Then the last one is that they have an anabolic effect in the liver. So they have anabolic effects in the liver. Then the second part, we have the immune response. Okay. So the immune response and regulation of inflammation. So now, when we say the immune response and regulation of inflammation here, what do we mean on that one? Okay, so immune response are the immunity response as well as regulation of inflammation. Now, inflammation, it is just any form of swelling, where you find to say that we have these two membranes. We have we have a membrane, and then we've got the fluids that are found inside the cells versus the fluids that are found outside the cell. So the fluids that we found inside the cell, we call them the intercellular fluids, and then the fluid that is found outside the cell, we call such fluid as in the extracellular fluids. Okay, so these ones, what happen is that if at all maybe there is an injury, what happen is that when this membrane leaks, the intracellular fluid goes now to the extracellular, and when it goes there, then we are going to have edemas as well as inflammation. Okay, so now let's look at how this regulation occurs. So they have corticosteroid. It has an anti-inflammatory effects on the body system by reducing vasodilation and edema. Okay, so it reduces vasodilation. Now, by now, I'm sure you are able to understand vasodilation. Okay, so vasodilation, this is where we had said this is just the relaxation of the blood vessels. Yeah, and then it will bring about edema. Now, edema, this is just the swelling part. So it has that part where now there is edema now. Okay, they also inhibit prostaglandins. They inhibit prostaglandin synthesis, which is a vasoactive substance. Okay, so now if they inhibit prostaglandin synthesis, which is a vasoactive substance, so meaning that then there will be a decrease in vasodilation. Okay, there will be a decrease in vasodilation, meaning that they've already inhibited prostaglandin, because prostaglandin is the one that usually increases vasodilation. Okay, now in an event whereby corticosteroids inhibits prostaglandin synthesis, then this will now cause a decrease in vasodilation, and it will now lead into the other things. Okay, now the other part, the fourth part, is they reduce healing by inhibiting inflammation. Okay, so they reduce healing. Remember, healing can occur like as in healing can only occur like in an event whereby inflammation is not normally as in it's a condition like as in a medical condition that is too serious. Sometimes inflammation is just a normal response of the body to heal. If at all there is an injury, the body responds. Inflammation is naturally, let me put it in that way, just naturally. So if these corticosteroids, they will just reduce the healing process by inhibiting inflammation that is under immunosuppression. Okay, so in a person that is immunosuppressed, will tend to have this inhibition of inflammation. Then besides that, they have immunosuppressive. Okay, they are immunosuppressive. Now, when we look at corticosteroid, these are immunosuppressive. They bring your immune system to become suppressive. Okay, so they reduce the antibody. So when we say immune suppressive, what I simply mean there is that they will reduce your antibody production, thereby reducing the white blood cell migration. Now, remember, when blood is moving in the blood vessels, and we have blood consists of, we have the leukocytes, which are the white blood cells. Then we have the erythrocytes, which are the red blood cells. So when these the blood are moving in the blood vessel there, the erythrocytes usually carries oxygenated blood and nutrients. And then the white blood cells, which are the leukocytes, these are soldiers that are accompanying these cells, so that they can deliver the oxygen as well as the nutrients to all the intended body organs. Okay, so now in these events, what we are going to see and what we're going to observe is that in an event where there is immunosuppression, if a person or a client has got immunosuppression, this simply means that they have a reduced number of antibody production. And when they have a reduced number of antibody production, this results into the reduced number of white blood cell migration. Now, when the white blood cell migration, now remember, antibodies works hand in hand with the white blood cells. Remember, antibodies, they also target the antigens. So this is how this whole entire thing goes. Okay, so now in this process, what happens is that when blood is moving through the blood vessels, then in an event, if there is an injury somewhere, the white blood cells will migrate they will migrate to the site of injury. Now, as they are moving against those blood vessels so that they can migrate, they reach to the site of injury. That movement is what we call diapedesis. So diapedesis is just simply the movement of these white blood cells against the concentration gradient so that they can reach to the site of injury. Okay, now let's look at the action of the gastrointestinal tract. So, what is the action of corticosteroid on the gastrointestinal tract? So they reduce the gastric mucus secretion. Okay, so they reduce the gastric mucus secretion and increases hydrochloric acid, and the pepsin production will now lead to ulceration. So the mode of action, these ones decreases inflammation and also suppresses the immune response, thereby stimulating the bone marrow and influences protein, fats, and carbohydrate metabolism. So, what are some of the indication or indicators that we can use to check this? So, they are used to treat a number of different disorders, especially inflammatory or immunological disorders. Then we have the adrenal. These ones, they also results into the other indication. The other indicator or indications, it is just adrenaline insufficiency, arthritis, as well as immunosuppressant in organ transplant. Then it can also bring about dermatitis, which is just the inflammation of the skin. Then besides that, it can also bring about allergic reactions, that is anaphylactic shock. Okay, anaphylactic shock, and then it can also result into asthma. Then besides that, it can also bring about hepatitis, as well as hypercalcemia, that is an increase in the levels of the calcium levels in blood. Then we have leukemia. It is just a decrease in the number of white blood cells production. So leukemia, it is just a decrease in the number of white blood cells production. Then besides that, we have anti-stress. So it also brings about anti-stress. Then besides that, we also have the lupus erythematosus. Okay, so on the lupus erythematosus, now this is where it also results. It's another indication of these drugs. Then besides that, it also brings about inflammatory bowel disease that include ulcerative colitis, as well as the Crohn disease. Then we have the uveitis. So uveitis, this is just the inflammation of the eye. So if you have eye inflammation, that is just uveitis. Then there is also, it also brings about cerebral edema. This is just the swelling just in the cerebral part. Then it also brings about respiratory stress syndrome. Then, and also premature labor. So it brings about premature labor. So these are the major contraindication effects of these drugs. Then babies born less than 32 weeks in premature labor. Okay, now, so those were just the indication. Now, what are some of the contraindication of these drugs? So the contraindication for these drugs, especially on patients with diabetes mellitus and patients that are having osteoporosis, that is now, these are patients that are having now bone diseases, like maybe perhaps they have got challenges, inflammation of the bones, that is arthritis, maybe, as well as osteoporosis itself, which is just the patients that are suffering with their bones. Okay, then besides that, we have the use of the cautions. Okay, so there is some cautions that are used in patients in elevated blood pressure, and we also have you need to avoid this one. It needs to be avoided in you need that to be avoided in ulcers, as well as avoid in TB patient. So this drug corticosteroid, like as in you cannot use it in patients that are having ulcers as well as patients that are having tuberculosis. Then what are some of the adverse effects? So on this adverse effect here, we have the thinning of the skin. So the skin become too thin, like it brings about the thinning of the skin. Then it also brings about peptic ulcers. So a person will start having peptic ulcers, and then hypocalcemia, low blood calcium levels. Then it also brings about poor wound healing. So now when we say poor wound healing, corticosteroid, how it brings about poor wound healing is that, remember what I had mentioned earlier on. I'd said that corticosteroid, it has the tendency of inhibiting inflammation. When it inhibits inflammation, then it will also delay the healing process. So that is what we mean when we say poor wound healing. Okay, then it also brings about osteoporosis. That is uh, the infection that has to do, diseases that has to do with the bones. Okay, then also the moon phase, as well as the trunk obesity, as well as immunosuppression, thin of the limbs, and growth retardation in child. This is where now you find that the child has been retarded in growth. That is growth retardation. Now remember, we were talking about this condition in pediatrics last time, where I had mentioned to say that if in a person, in an event whereby a child is not growing, so in this instance here, corticosteroid can also bring these adverse effects, like in growth retardation in children. Okay, then it also brings about cataract formation. Okay, cataract, now these are eye disorders. Okay, then it also brings about glaucoma, which is also another eye disorder. It brings about hyperglycemia. Okay, it brings about hyperglycemia. That is an increased this is an increased blood glucose level. Increased blood glucose level is hyperglycemia. Then we have adrenal atrophy. Brings about adrenal atrophy, as well as psychosis and depression and diabetes mellitus. So I have an activity for you guys, and here is the activity. And on the activity, I want you to explain how corticosteroid can predispose someone to have diabetes mellitus. Write your answers and then send them to my WhatsApp number. I'm gonna check them up and then mark them and give you the scores. Okay. So explain how corticosteroid can predispose someone to have diabetes mellitus. So write your answers on a piece of paper and then capture it and then send it back to me. All right. Okay. Okay, so now let's look at the examples of drug interaction. Okay, now let's look at the drug interaction. We have aspirin, indomethacin, brufen, as well as so these are what we call the NSAIDs. Okay, so these are the new the acronym that you should familiarize yourself. Then we have the barbiturates, the pythonine, as well as the rifampicin. Okay, then we also have the oral anticoagulant, as well as the thiazine latex. Okay, so let's start with the first one, which is prednisolone. Okay, prednisolone. Okay, prednisolone, it has less mineralocorticosteroid activity, and it has longer duration on action than cortisol. Then it is also an anti-inflammatory as well as immunosuppressant. Okay, it's an immunosuppressant. So on the presentation of this prednisolone, okay, it is supplied with maybe supplied as 5 milligram tablet. So it is supplied as in a 5 milligrams tablet, or in an injection form it can be 25 milligram per mil, or it can be 100 milligram per mil. Then the suppository pharmacokinetics, it is lately absorbed after oral administration. So when you take it orally, then it's gonna absorb. That is what we mean here. Then it is lately absorbed after orally administration widely. So distributed to the muscles, skin, intestine, and the kidney. It is metabolized in the liver and excreted as inactive metabolites and small unmetabolized drugs in urine mostly. Okay, so now the dosages. Let's look at the dosages. Several information or immunosuppression. In adults, we need to take 2.5 to 15 milligrams. That is 2 to 4 times a day. That is PO. So PO simply means 4 to 5 times per day. Okay, so it is 2 to 4 times a day. Okay, then or we just take 2 to 30 milligrams IM, that is intramuscular. When you are doing it in the form of an injection, you need to give a dosage of 2 to 30 milligram intramuscular or intravenous. So you need to inject it on a muscle, or you inject in the vein. You need to inject and then you inject for 12 hours. Then you leave the drug just to work on that very part. Then beside that, we also have what we call the proctitis. Proctitis, this is just the inflammation of the rectum. So if the rectum gets inflamed, that we call it as an proctitis. Okay, so this one's it is just a suppository abide, preferably in the morning. Okay, so then we have ulcerative colitis. Ulcerative colitis, it also comes about due to, okay, it can also wake, like as in, it is just on the information of the ulcers, like in the tummy, like as in the stomach, and also the intestine, so the cervix or entire presentation goes. Then we have the dexamethasone. Dexamethasone is a it's a glucocorticoid. It's a glucocorticoid with anti-inflammatory as well as immunosuppressive effects. So on the presentation of this drug is that the drug is supplied as a tablet, and in an injection format. It varies in length, and it is readily absorbed. That is 2 to 4 times a day. Okay, PO for administration. Then pharmacokinetics absorption are just done after an injection, depending on the site of injection. This can be distributed to the muscle, the liver, the skin, intestine, as well as the kidney, that are metabolized in the liver to the inactive metabolite. Okay, so inactive metabolite and small amount of unmetabolized drugs secreted by the kidney, that is what we call therapeutic effects. Okay, now what about the dosages? So the dosages for this drug is that they have what we call cerebral edema. They have what we call cerebral edema. So the use of dexamethasone, that is, dexamethasone contains sodium phosphate. Like in adult, we can only give 10 milligram intravenous, then 4 to 6 milligram intramuscular for 6 hours until the symptoms subside Then the dose is tapped over for 5 to 7 days. Okay. Then besides that, we have the inflammatory condition, allergic reaction that will result into neoplasia. In adults, we need to give about 0.75 to 9 milligram per day. That is 2 to 4 times daily. And then we have 0.5 to 9 milligram per day in intramuscular. This will now result into what we call phosphate, and 1 to 4 milligram is secreted and is used. So it shocks adult, and we have 1 to 6 milligram kg per kg IV intravenous. Okay, that is the route of administration. Intravenous as just a single dose, or 40 milligram intravenous, that is for 2 to 6 hours when necessary. So if you have questions, please feel free to ask. Today we shall end on page 25. Okay, well, we'll end on the slide number 25. Okay, so next time we are gonna look at hydrocortisone. Okay, we'll look at hydrocortisone. Thank you so much for your attention. Shalom.